Hi physios, welcome back to our channel. In today's topic, we are going to discuss about the cardiovascular system, its introduction and a few notes about it. Let's start the video. Primary function of the cardiovascular system is to supply blood cells with oxygen and nutrients and carry away carbon dioxide and waste products. Cardiovascular system is a closed circuit system composed heart, arteries, capillaries, veins, blood. We can divide the primary function of the CVS into two major divisions. Pulmonary circulation carries blood to the lungs, eliminates carbon dioxide via the lungs, and return blood to the heart. Systemic circulation supplies blood to the rest of body, delivers oxygen to all the body, and carries away wastes. Heart is a cone-shaped hollow muscular pump. Size the adult heart has a mass of between 250 to 350 grams and is about the size of a clenched fist, around 14 cm long and 9 cm wide. Location: the heart lies in the mediastinal area of the thoracic cavity between the lungs. Surrounding structures: posterior to the sternum, medial to the lung, anterior to the vertebral column, on the top of diaphragm. About 2/3 of the heart lies left to midline. Apex, base, surface of the heart. Base is formed by a left and right atria, mostly of the left atrium found beneath the second rib. Apex lies in the left fifth intercostal space formed by the left ventricle, inferior or the diaphragmatic lines on underside it formed by left and right ventricle. Anterior or the sternocostal lies just behind the sternum and the ribs, formed mostly by the right ventricle. Left pulmonary formed mostly by the left ventricle. This is the site of auscultations by the wall between the fourth intercostal space. That is, this is mentioned wrongly, but it's fourth or the third intercostal space. Aortic from the right side, left is pulmonic, tricuspid, bicuspid, and also respondingly 5 electrodes can be placed. Pulmonic, aortic, tricuspid, bicuspid, okay, is otherwise called as mitral. So this is the diagram, location of walls and sites of auscultation parts. So this is the exact location of the thoracic organ. Pericardium, a sac called pericardium covers the heart. The pericardium restricts the heart movements in the thoracic cavity and prevents overfilling with the blood. The pericardium is composed of two parts: fibrous pericardium, serous pericardium. Is the outer part of the fibrous pericardium is the outer part of the pericardium and is composed of tough, dense connective tissue. Serous pericardium is the inner part of the pericardium and is composed of two subdivisions: a parietal layer that lines inner surface of the fibrous pericardium, visceral layer, the epicardium that covers outside of the lung. Pericardial cavity, a thin space between the parietal and visceral layers of the pericardium which covers a serous fluid. The serous fluid lubricates the membranes and prevent the friction during heartbeat. So this is the heart wall structure. Pericardium is the outer layer, myocardium is the inner layer. This is the pulmonary trunk which has fibrous pericardium, parietal layer of the serous pericardium, pericardial cavity, epicardial, that is the visceral layer of the serous pericardium, heart wall, myocardium, endocardium, heart chamber. So first layer is pericardium, second is epicardium, myocardium, endocardium, and the heart chamber, heart wall structure. Okay. Heart wall consists of 3 layers: pericardium, epicardium. Epi means upon or above, is the outermost part of the heart, composed mainly of simple squamous epithelial and areolar connective tissue. Myocardium, myo means muscle, is the middle layer of the heart wall and is composed of cardiac muscle tissue. The myocardium is the thickest of the 3 heart layers. Endocardium, endo means within, is the inner layer of the heart wall and is composed of simple squamous epithelium and a layer of areolar connective tissue. The endocardium also covers the surface of walls and continues as the endothelium of the blood vessels. So this is the pericardium and the wall structure. Just you can have a look. Chambers of heart. Heart consists of 4 chambers, 2 superior chamber known as atria, right and left it is divided into, and two inferior chambers ventricles, left and right ventricle. Right atrium, it receives deoxygenated blood, passes it right ventricle, opening into right atrium. So superior vena cava, inferior vena cava, coronary sinus, and right atrioventricular opening. What is superior vena cava? Blood comes from head, neck, upper limbs, and superior regions of the trunk and enters into the right atrium. It's deoxygenated blood. Inferior vena cava, blood comes from the lower limb and the trunk enters into right atrium. This is also the both will opens into right atrium. Okay. Coronary sinus, blood comes from the heart wall and enters into right atrium. Right atrioventricular opening, blood leaves right atrium and enters into right ventricle. This opening is guarded by the tricuspid wall. Interatrial septum forms a thin wall between the right and left atria. Fossa ovalis is an oval depression in the interatrial septum. It represents a remnant of fetal foramen ovale. So it is called as fetal foramen ovale. This is the opening, or it's called as the hole. It should be closer. It should be closed after adulting stage, after infant stage. Right ventricle. Right ventricle forms most of the anterior surface of the heart. Deoxygenated blood flows into the right ventricle from the right atrium. Opening of the right ventricle. Right ventricle atrioventricular opening via tricuspid wall. Blood enters ventricle. Pulmonary trunk, blood leaves the right ventricle and enters into the pulmonary artery. The interventricular septum forms a thick wall between the right and left ventricle. So this is the pathway of so when the deoxygenated blood ends, it enters to right atrium via superior vena cava and inferior vena cava, where into right atria by right ventricle via right atrium and passes through pulmonary artery. So pulmonary artery carries deoxygenated blood. Also, next it enters into lung, and after oxygenation it enters via pulmonary vein through left atrium into left ventricle, and left ventricle to aorta to all the parts of the body. Pulmonary artery carries deoxygenated blood. Pulmonary vein carries oxygenated blood. It's an exceptional case. Left atrium. Oxygenated blood enters the left atrium via the pulmonary veins opening of the left atrium. So pulmonary vein blood comes from the lungs and left atrium. Left atrioventricular opening, the blood leaves left atria and enter the left ventricle. This opening is guarded by the mitral bicuspid valve. Left ventricle, oxygenated blood flows into the left ventricle from the left atrium. The wall of the left ventricle is 2 to 3 times as thick as the right ventricle. Opening in the left ventricle. Number 1, left atrioventricular opening, blood comes from the left atria. Aortic, blood leaves the left ventricle to flow into the aortic artery. It is guarded by aortic valve. The walls are the connective tissue flaps that lined by epithelial tissue. Their function is to permit the passage of the blood in one direction and prevent backflow. In the heart, there are 4 valves, 2 atrioventricular, 2 semilunar. Atrioventricular valves, right atrioventricular valve tricuspid is made of 3 cusps. Left atrioventricular valve, mitral or the bicuspid, is made up of 2 cusps. The free edges of the cusps are attached to the papillary muscles through the cord-like structure called as chorda tendinae. Papillary muscles. These are the muscles cone-shaped which originate from the ventricular wall. Their apex are connected to the chorda tendinae. Chorda tendinae are the fine tendinous cord which are attached from the papillary muscle to the border of cusp. This attachment is to prevent the bulging of the valves into atria during ventricle contract. Semilunar valve, aortic valve, pulmonary valve. Aortic valve present at the opening the aorta in left ventricle has 3 cusps. Pulmonary valve present at the opening of pulmonary trunk and has 3 cusps. These valves open when ventricle contract to allow the blood to flow from right ventricle to pulmonary artery and from left ventricle to aorta. They close when ventricle relax. This is the cardiac muscle. So the cardiac muscle and heart function. Cardiac muscle fibers are striated. Sarcomere is the functional unit. Fibers are branched to connect to one another at the intercalated disc. The disc contains several gap junctions. Nuclei are the centrally located adjunct mitochondria. SR is less abundant than in skeletal muscles but greater in density than the smooth muscles. Sarcolemma has specialized ion channels that skeletal muscle does not. Voltage gated Ca2 plus channels. Fibers are not anchored at the ends, allows for greater sarcomere shortening and lengthening. So this is also the structure of this is the structure of valve layers. Okay, where the intercalated disc is present between two fibers. Gap junction is also present. Electrical current is passing. This is plasma membrane outer layer. Sarcomere inner, that is the electrical transfer takes place. Desmosome is also present between two fibers. This is heart and this is the transverse section of the heart. Tricuspid valve posterior side and posterolateral side. What we do have is bicuspid or the mitral, left side of the heart, right side of the heart. We do have the aortic. Aortic valve is also present at the mid-axillary line, and anteriorly what we do have is a pulmonary valve. Tricuspid, bicuspid and pulmonary are the three valves, and also aortic or the four valves. Tricuspid, bicuspid, pulmonary and aortic. This is the interior view of heart or the mid-sagittal view. Aorta, superior vena cava, inferior vena cava, tricuspid, bicuspid valve, right and left atrium, pulmonary valve, aortic valve, orifices of the coronary artery is also present. Externally, sulcus of the heart. Coronary sulcus. Atrioventricular sulcus is a relatively deep groove that extends around the heart and separates atria and ventricle. Anterior interventricular sulcus and posterior interventricular sulcus are located between the left and right ventricles. Fibrous skeleton of the heart is located between the atria and ventricles. Functions separate the atria and ventricles, anchors heart walls, provide electrical insulation between atria and ventricles to prevent the contraction of all chambers at the same time. Blood supply to the heart. Arteries, left and right coronary arteries, their origin is ascending aorta. Right coronary artery, it gives two branches. Right marginal artery, it supplies the right border of the heart. Posterior interventricular artery, it supplies the right and left ventricle. Left coronary artery, it gives the following branches. Anterior interventricular artery, left anterior descending artery, it supplies the anterior surface of both the ventricles. Circumflex artery supplies the left atrium and ventricle. Veins, coronary sinus. Receive blood from number 1, great cardiac vein, number 2, middle cardiac vein, and number 3, small cardiac vein. The coronary sinus open directly into the right atria. This is the pictures. Just you can have a look. Anterior view, posterior view. Connection among smaller arteries are called as the anastomosis. So what is called as anastomosis? It's an important 2-mark question. Connection among the smaller arteries is called as anastomosis. Anastomosis may delay appearance of ischemic heart symptoms. So in the case of ischemic heart diseases, this anastomosis may delay. What? The small artery connection may delay. Nerve supply to the heart. Sympathetic, derived from the thoracospinal cord T1 to T2. Stimulation of the heart by sympathetic nervous system leads to increased heart rate, tachycardia, increase of force of contraction, and dilation of coronary arteries. Parasympathetic, branches of the vagus nerve, cranial nerve 10. Stimulation of the heart by parasympathetic nervous system leads to slowing of the heart bradycardia. So increase of the heart rate is tachycardia, which is responsible from the spinal cord, that is the thoracic level T1 to T2. And the cranial level 10, it's slowing of the heart, bradycardia, reduction in the force of contraction and constriction of the coronary arteries. So just you can have the look about this. The vagus nerve, and the sympathetic cardiac nerve. Conducting system of the heart. The heartbeat originates in a specialized cardiac muscle cell, cardiac conducting system, and spreads via the system to all the parts of the myocardium, parts of the conducting system. SA node, that is sinoatrial node, is located in the posterior wall of the right atrium, and sinoatrial node is located in the posterior wall of the right atrium at the junction of superior vena cava with the right atrium. With the right atrium. So, atrioventricular node, that is AV node, is located in the right posterior portion of the interatrial septum. Bundle of is located in the interventricular septum and divided into branches right and left. Purkinje fibers begins within the apex of the heart and extends through the wall of the ventricle. The system has ability to stimulate the cardiac contraction without any interventions. So, SA node stimulus originates in the SA node and travel across the wall of atria, causing them to contract. Then stimulus arrives at the AV node. This is the conduction system of heart. The main 4 points. Stimulus arrives at the AV node and travels along the AV bundle. Stimulus descends to the apex of the heart through the bundle branches. After stimulus reaches the Purkinje fibers and ventricle contract. Electricity and action potential of the cardiac muscle. Myocardial fibers have a resting membrane potential of approximately minus 90 MV. At rest membrane potential, the Na plus channel and Ca plus plus channel are closed, while some leakage of the K plus through K plus channel. The action potential is stimulated cardiac myocyte is divided into 5 phases. Phase 0, rapid depolarization, occurs due to rapid Na plus influx. Phase 0, rapid depolarization, occurs due to rapid Na plus influx. So the inner membrane gradually becomes less negative. When the membrane potential becomes minus 40 MV, reaches the threshold for initiating action potential. The Ca++ influxes leads to produce the rapidly rising phase of action potential depolarization. The membrane potential reaches to plus 30 MV. In phase 1, initial rapid repolarization, that is, it's a short phase. The membrane potential in this phase reaches to minus 10 MV, and this phase occurs due to the closure of Na plus channel and opening of K plus channel. Phase 2 is plateau. It occurs due to slow influx of Ca++. And phase 3 is repolarization. During this phase, complete repolarization and the membrane reaches to approximately resting value. Phase 4 is resting potential. The membrane potential is maintained minus 90 MV. Action potential of the cardiac muscle. So this is the graph which illustrates the membrane potential versus the time. Action potential causes the release of Ca++ into cytoplasm from sarcoplasm, which causes the muscle contraction. All heart cells are electrically joined one to another by intercalated disc, gap junction. So one cardiac muscle generates action potential, it is just spread to other. Duration of action potential is about 250 microseconds at the heart rate 75 beats per minute. The duration of the action potential decreases when heart rate increases. What is cardiac cycle? It is the inclusive period of the time from the start of one heartbeat to initiation of the next. In each cardiac cycle, there are alternate contractions and the relaxations of all chambers. Each contraction is called as systole and relaxation is diastole. The events at the single cardiac cycle: atrial systole, contraction of both the atria left and right simultaneously leads to move blood 20% from atria to ventricle, from right atria to right ventricle through tricuspid wall, and from left atria to left ventricle through mitral wall. Atrial diastole, ventricular systole. In this period, the tricuspid and the mitral wall are closed and the blood forced into the blood vessel through semilunar valves, from the left ventricle to the pulmonary artery and from left ventricle to the aorta. Ventricular diastole, most of the blood, 80%, flows passively from relaxing atria into the ventricles through the open atrioventricular valve. So this is the phase: atrial systole, early ventricular diastole, late ventricular systole, early ventricular diastole, late ventricular diastole. This is how the exact cardiac cycle takes place. Next, heart sounds. Lub and tub. Lub sound made by the contraction of the ventricles and closure of tricuspid and mitral valves. Dub made by closure of pulmonary and aortic valves when ventricles relax. Okay, this is heart sounds. ECG or EKG. It refers to record of the potential fluctuations during the cardiac cycle due to sequential spread of the excitation in atria, interventricular septum, ventricular valve, repolarization of the myocardium. These events appear in the ECG as a series of positive and negative waves, PQRS. So, ventricular atrial diastole, atrial systole, atrial diastole, ventricular systole, ventricular diastole. One cardiac cycle. What are the waves of ECG? P wave indicates atrial depolarization. QRS complex indicates ventricular depolarization. T wave indicates ventricular repolarization. PR interval indicates it's measured from one onset of P wave to other onset of QRS complex. It measures the AV conduction time. Its duration varies from 0.12 to 0.2 seconds. QT interval. It is the time from the start of QRS complex to end of T wave. It indicates a total systolic time of the ventricular depolarization and repolarization. PQ segment and TQ segment. So these are the three segments. These are the four segments: PR, QT, PQ, ST. ST segment, it is an isoelectric period between the end of QRS and beginning of T wave. Its duration is about 0.32. So this is the normal sinus rhythm of ECG pattern. Clinical applications of ECG. It is important in the diagnosis, prognosis, and planning treatment of the cardiac disorder. Example, cardiac arrhythmias, myocardial infarction, cardiac hypertrophy, changes in the ionic composition of the heart. So what is cardiac output? It means the amount of blood rejected by each ventricle per minute. Stroke volume is the amount of blood ejected by each ventricle per beat. Cardiac output. So cardiac per beat. Stroke volume is the amount of blood ejected by each ventricle per beat. Cardiac output is equal to stroke volume into heart rate. So students, hope you guys have learned something new in this video. Please do take a notes. It's just the introductory part. If you want to make me even more detailed contents for your NEET PG or NEET UG, please do leave a comment. Happy learning.